How many of you are interested in knowing how to keep your heart healthy? And how many of you are worried that you may have some heart problem or the other in your lifetime? This is Dr. Lenny DaCosta, a geriatric physician, a functional medicine expert, and the author of the upcoming book, Is Your Doctor Keeping You Sick? My dear friends, no better day to delve into these issues than today, on the eve of the World Heart Day. In the last 18 years, I have treated over 25,000 heart patients. And today, I'd like to share some of the information that came my way that could benefit you to live a happy, healthy life. For starters, please remember, it's not your cholesterol that causes heart disease. So while you may have a normal cholesterol number, doesn't mean that you are having a healthy heart. So what are the other things that we need to look at to ensure that we have a healthy heart? In the investigations that most people look at, we forget to see some of the very, very important investigations. And these, for me, there are three important investigations. One, you need to look at your homocysteine levels regularly. Number two, you need to look at your hsCRP levels. Now, what is hsCRP? It is the marker for inflammation. And remember, it is intra-arterial inflammation that leads to plaque formation and not cholesterol. Cholesterol is present there. It's the innocent bystander. It does the dirty work and gets the blame for everything. But the main offender is inflammation. And that can be tested by a blood test well before you have the episode. So you need to have a blood test done for hsCRP. Remember, hsCRP is the second marker that you need to check. The third one is lipoprotein Ldl. Lipoprotein Ldl is 30 times more atherogenic, meaning 30 times more plaque, or that block forming has a power 30 times more than oxidized LDL. Normal LDL is not bad cholesterol. Oxidized LDL is bad cholesterol. Let me explain that to you a little later. But lipoprotein Ldl is 30 times more atherogenic. That means more dangerous than oxidized LDL and is responsible for plaque formation. Specifically, those people who keep getting problems of ischemic heart disease even after they have done their surgeries, after they've done their angioplasties. These are people who may be having high lipoprotein Ldl. So you need to check it. Any lab does it. So these are the three very important markers which will decide how healthy your heart is and whether you will get any problems due to your bad physiology or biochemistry within your body. Now, there is one other marker that also plays havoc, and that is your fasting insulin levels. Why fasting insulin levels? Because it tells us about the insulin signaling in our body. Insulin signaling can cause a whole lot of obesity, and it can also lead to diabetes and bad carbohydrate metabolism going forward. So you need to also check for fasting insulin levels. Now let's look at what you can do and what are the things that you can do to ensure that these come into play a little later. Why is your cholesterol numbers not really the ones that you need to look at? Because what we look at is LDL, HDL, total cholesterol and triglycerides. What you needed to look actually for was oxidized LDL, which we don't look at. What is oxidized LDL? Oxidized LDL is basically rancid LDL. LDL is a lipoprotein carrying cholesterol to the site where it's supposed to work. So when cholesterol is made in your liver, my dear friends, it's made for your body to repair itself. And LDL only takes it from your liver to the site it's supposed to be working at, and HDL brings it back. Now, We have given them loose connotations as bad cholesterol and good cholesterol. Why is LDL actually called bad cholesterol? Because if it is in excess in your blood, it can get oxidized, and when it gets oxidized, it is really bad. So it's oxidized LDL that is bad, not normal LDL. And lipoprotein little a is 30 times worse than oxidized LDL. Now, having said this, what are some of the things that you can do to ensure that these markers are well within control? For starters, you need to, if you are smoking, give up smoking, because smoking leads to increased inflammation in the body. So an increased hsCRP levels. It also increases a whole lot of toxins in the body, which causes further inflammation, giving rise to plaque formation. So no smoking. Reduced alcohol, because alcohol dampens the detoxification effect of your liver, so less alcohol, or reduce the alcohol consumption. No alcohol would be ideal. Control your blood pressure if you have issues with your blood pressure with proper medication, and control your sugar if you're a diabetic. If you aren't, you need not worry about these two. Then you need to exercise daily. Exercise single-handedly takes care of a lot of issues. I spoke about fasting insulin. Yes, exercise alone will ensure that your fasting insulin levels come down and your insulin signaling is proper. Exercise alone will make sure that your triglycerides are not very high, even if you have a high carb diet. Exercise alone will take care of the excess carbs that you have, which can be burnt out. Exercise alone takes care of all the stress, which is also responsible for a lot of the markers to go up. Exercise alone will ensure that your methylation cycle is proper and your homocysteine levels are low. So exercise 10 minutes, 20 minutes every morning goes a long way in keeping your heart healthy. Then you need to eat right, eat healthy, balanced diet, and hydrate well. What I mean by eat right: reduce your carbs, increase your fats, and good fats. Use virgin coconut oil or cold pressed coconut oil, cold pressed olive oil, and homemade ghee. One of these three can be used, or all three. But use this. Stop using hydrogenated oils, which are trans fats, which affect your heart very badly. Eat local food, local veggies. Don't bring stuff from all over the world. They are not really very nutritious. Eat moderate protein and ensure that you hydrate yourself well. Try and have as much of organic veggies as possible so that you don't have too much of toxins getting into your body. And finally, you need to do your lifestyle modification and keep that mind free of stress, because stress is the cherry on the cake. Stress can cause that heart attack that you don't want to cause. Stress can create that problem for your heart that you have been trying not to create with every other measure. So stress alone can be a major risk factor. How do you go about getting rid of stress? 1, start with mindfulness, good mindfulness exercises, 2, yoga, 2, meditation every morning. Like I said, exercise, you need to give the mind a calm time. So you need to train your mind to become calm and not react to any instance and create stress. So you need to mindfulness, yoga, meditation, 3 ways of doing it. Whenever you feel stress, the one way to do it is laugh, move away from the problem, stop thinking about it, go read a joke, go and watch a funny movie, go and watch a comic performing, and laugh. Laughing releases different hormones in your brain, which reduces the stress. Stress reduction alone saves you from that heart attack. So this is another way. And finally, every time you feel stress, use a relaxation method that I normally adopt and tell my patients a lot to do it, besides trying to laugh, because you can't laugh if you're in an office or you're really stressed out at work. Sometimes you may not be able to do it. Just sit down, relax, deep breathing exercises, and start counting from 100 to 1. This alone will help you to relax tremendously. My dear friends, I've given you a few tips how you can reduce those markers and maintain good heart health on the eve of the World Heart Day. I wish you well, and I wish you happy, healthy life going forward. If you like this video, please share it with your friends. Do give me a thumbs up and do subscribe to my YouTube channel, because I have tons and tons of videos and you'll get every video on that YouTube channel. You can see it anytime you want. I'll see you soon in my next video. Bye.